for Lauren?
Lauren?
That's me.
Hi, I'm Casey. I'm going to be your dental hygienist today. If you want to follow me back this way. How's your day going today?
Good.
Okay, so we're going to be right in here.
Hello. Today we follow Casey, our clinician, as she experiences 2 medical emergencies on the same day. Let's watch.
You can go ahead and have a seat there. So what brings you in today?
Just for cleaning.
Okay, so it looks like your last cleaning was in March of 2020.
Mm-hmm.
And do you have any pain, discomfort, popping in your jaw?
Yeah, I actually do have TMD on both sides
Okay.
from my wisdom tooth removal,
Okay.
but it doesn't hurt.
And are you taking any medications?
No.
During a medical history, a clinician should be able to spot disorders such as hemophilia, COPD, arthrosclerosis, hypertension, and any nasal septum issues, as these might lead to a more severe nosebleed.
Okay, and nothing over the counter?
A vitamin when I remember, but not very often.
Okay, and then it looks like you circled that you have some sinus problems?
I do, yeah. You know, I have a deviated septum, and then I also get regular colds when the seasons change, just like everybody else, but not right now.
Yeah, the weather's been kind of cold,
It
dry.
has. Very unusually dry.
During the small talk exchange by Casey and the patient, the weather was brought up. Nosebleeds are a common occurrence during cold and dry seasons such as winter and fall. We should all pay close attention to our patients who are more likely to experience nosebleeds during these seasons.
Okay, so I'm gonna go ahead and put my stuff down and then I'm gonna lay you back.
Okay, sounds great.
Let me just wash my hands. Okay, so I'm gonna go ahead and put your bib on. This will just be sure we don't get anything on you while we're treating you today. I'm gonna raise you up just a little bit. You comfortable?
I could take a nap.
Okay, so I'm just gonna have you open so I can take a look and see what's going on inside. Okay, awesome. You can go ahead and relax. Wow! Oh, wow! Okay, so it looks like you're having a nosebleed. I'm gonna go ahead and sit you up. Paper towels. So actually, we're gonna have you go ahead and sit forward so the blood does not drip down your throat. Stephanie, can you please grab me a basin?
Oh yes, coming.
So I want you to apply pressure. Perfect. And then lean forward like this. Great. Here you go. Thank you. So I'm just gonna hold this underneath you. So I'm just gonna give you a wet towel.
Okay. Thank you.
So I don't lean back? I was always told to lean back.
You actually want to be leaning forward so the blood doesn't drip down your throat and you swallow it. We want it to drip out.
Okay.
By directing the patient to lean forward and apply pressure, Casey was able to stop the nosebleed and resume treatment. Casey did an excellent job handling this medical emergency.
Oh.
What Casey should have done here is notified the patient to not blow their nose. By not blowing the nose, the patient is more likely to stop bleeding and is less likely to start a new nosebleed.
So you actually don't want to be blowing your nose.
No?
That's going to release the clot and it won't stop bleeding. So we want it to stay clotted so you'll stop bleeding. So if you continue to pinch for the 2 to 5 minutes, it should stop.
Okay. I haven't had a nosebleed in so long. I forgot what to do.
You know, it's probably just that weather change. It can happen, unfortunately.
Yeah. Ugh. I'm so embarrassed. I'm sorry.
Oh, don't worry about it. Not a big deal. We deal with blood all the time.
Thanks, Casey.
No problem. Stephanie? Hi, I'm Casey. I'm going to be your hygienist today.
How are you?
Good. How are you? We've had a little bit of an eventful morning here today in the office.
Oh, okay.
So we're going to come back this way. Okay, so we're gonna be right in here today. You can go ahead and have a seat. Okay, so I'm just gonna take a look at your medical history. No clicking or popping when you chew and your jaw at all? Okay, and it looks like you're healthy. Do you take any medications?
No medications.
Nothing over the counter? Nope. Have you had any surgeries or hospitalization recently?
Nope.
Okay. Okay, so everything looks good here. Okay, so today what we're gonna be doing is called a scaling and root planing. It could be a little bit uncomfortable for you, so we are gonna be using some local anesthetic to help numb the area up so you're not feeling anything uncomfortable.
Okay.
Okay, so I'm gonna go ahead and lay you back. Okay, so I'm gonna go ahead and have you open. And I'm gonna have you lift your chin up. Okay, perfect.
Casey is now ready to start an SRP on a patient. To aid in patient comfort, she'll perform an IA injection. This injection has a high aspiration rate, so Casey should aspirate before injecting.
Okay, so I'm just gonna rinse you out.
Unfortunately, Casey failed to aspirate, and this has led to a hematoma. Casey should now apply pressure, followed by an ice pack, and see if the hematoma continues to enlarge.
So it looks like you're having a little bit of a reaction to the anesthetic. I'm gonna go ahead and sit you up. And we're gonna apply some pressure. Okay, so we're just gonna be applying pressure for a little bit. So I'm gonna be holding this here. Okay, I'm just gonna check. So it looks like pressure is not doing what we wanted. So I'm gonna go have someone grab an ice pack, okay?
Okay.
Lauren, can you please get an ice pack?
Yeah, oh my god. Here.
Okay, so I'm gonna have you hold this to the side of your face while I apply pressure. Okay, so at this point it looks like the bleeding has not stopped. What's happening is you're having bleeding releasing into your tissue from the local anesthetic. So we're gonna go ahead and contact EMS. What we're doing in the office is not able to stop it.
Hematomas can be a common occurrence in the dental office. Casey recognized the hematoma, stopped treatment, applied pressure and ice pack, and then notified EMS when the hematoma did not stop enlarging. We can avoid hematomas by aspirating before injection and avoiding unnecessary trauma while injecting.